Welcome to our channel. In today's video, we'll explore the most common aged care interview questions and provide you with effective answers to help you stand out. Whether you're a seasoned professional or new to the field, these tips will prepare you for success in your interview. First question, tell me about your experience working in aged care. Tip, don't just list your duties. Focus on a specific experience that highlights your skills. Sample answer. I have worked in aged care for over 3 years, primarily as a personal care assistant in a residential facility. My responsibilities included assisting residents with daily activities such as bathing, dressing, and meal preparation. I also helped organize recreational activities to promote social engagement. Additionally, I completed a certification in aged care, which provided me with valuable knowledge about the physical and emotional needs of elderly individuals. Why did you choose to work in aged care? Tip, show personal motivation and passion for elderly care. Sample answer. Growing up, I spent a lot of time with my grandparents, and I saw firsthand how important quality care and companionship are for older adults. That experience inspired me to pursue a career in aged care, where I can make a meaningful difference in people's lives by providing comfort, dignity, and support to those who need it most. What do you believe are the most important qualities for someone working in aged care? Tip, focus on qualities that reflect empathy, patience, and communication skills. Sample answer. I believe the most important qualities for someone in aged care are empathy, patience, and strong communication skills. Empathy allows us to connect with residents on a personal level and understand their feelings and needs. Patience is crucial, especially when working with individuals who may have cognitive impairments or require extra time to complete tasks. Lastly, effective communication helps us build trust with residents and their families, ensuring that we provide the best possible care. Describe a time you had to handle an emergency. What steps did you take? Tip, use the STAR method to structure your response. Sample answer. During my time at the aged care facility, I encountered a situation where a resident collapsed in the dining area. I quickly assessed the situation and called for help while ensuring the resident was safe. I checked their pulse and breathing and began CPR until the medical team arrived. Thankfully, the resident was stabilized and taken to the hospital. This experience reinforced the importance of remaining calm under pressure and being prepared for emergencies. How would you handle a resident with dementia who becomes agitated? Tip, show your knowledge of de-escalation techniques. Sample answer. When dealing with an agitated resident with dementia, I would first try to identify any triggers that may have caused their agitation. I would approach them calmly and speak in a soothing tone, using their name to establish a connection. I might redirect their attention to a favorite activity or memory, or offer a comforting object, like a soft blanket. If necessary, I would involve other staff members to ensure the resident feels supported and safe. Tell me about a time you faced a challenging situation with a resident. Tip, share a specific example that highlights your problem-solving skills and compassion. Sample answer. I once cared for a resident who was very resistant to receiving help with personal hygiene. I took the time to sit down with them and understand their concerns. After listening, I learned that they felt embarrassed and wanted to maintain their independence. I worked with them to create a plan that allowed them to feel more in control, such as setting specific times for assistance while encouraging them to do as much as they could on their own. This approach helped build trust and made them more receptive to care. How do you support residents and families during end-of-life care? Tip, emphasize empathy and communication. Sample answer. I believe in providing holistic support during this sensitive time. For residents, this means ensuring their comfort, dignity, and emotional needs are met. For families, it involves open communication, providing information, and offering emotional support. I might facilitate connections with spiritual advisors or grief counselors if desired. It's about being present and offering compassion during a difficult journey. A resident refuses to take their medication. How would you respond? Tip, emphasize your approach to understanding the resident's perspective and ensuring their well-being. Sample answer. If a resident refuses to take their medication, I would first try to understand their reasons for refusing. I would ask open-ended questions to encourage them to share their feelings. If they have concerns about side effects or the necessity of the medication, I would listen and validate their feelings. I would then explain the importance of the medication in a way that is easy to understand and, if needed, involve a nurse or doctor to address any medical concerns they may have. Working in aged care can be stressful. How do you manage stress and ensure quality care even during busy times? Tip, highlight specific stress management techniques and emphasize teamwork and prioritization to maintain quality care. Short answer. I manage stress by prioritizing tasks, practicing deep breathing exercises, and taking short breaks when possible. I also rely on teamwork, communicating openly with colleagues to share responsibilities, ensuring that we provide quality care even during busy times. What experience do you have with administering medications or assisting with medical needs? Tip, be honest and specific. If your experience is limited, Highlight any related training or willingness to learn. Sample answer. I have received training in medication administration as part of my certification in aged care. In my previous role, I assisted nurses with administering medications to residents, ensuring that I followed the correct protocols and dosages. I also monitored residents for any side effects and reported any concerns to the nursing staff. My experience has taught me the importance of accuracy and attention to detail when it comes to medication management. How do you ensure that residents maintain their dignity and privacy? Tip: discuss your approach to respecting residents' rights and preferences. Sample answer. I always knock before entering a resident's room and wait for permission to enter. I speak to residents respectfully, addressing them by their preferred name. During personal care, I ensure privacy by closing curtains or doors. I also encourage residents to make choices whenever possible, such as what to wear or what activities they'd like to participate in. It's about respecting their autonomy and individuality. What do you find most rewarding about working with elderly individuals? Tip: share your personal feelings and experiences that highlight the joy of caregiving. Sample answer. The most rewarding aspect of working with elderly individuals is the opportunity to build meaningful relationships and learn from their life experiences. I find joy in hearing their stories and witnessing their resilience. Knowing that I can provide comfort and companionship during their later years is incredibly fulfilling. Each day brings new moments of connection, and I cherish the smiles and gratitude I receive from the residents. How do you maintain your own well-being while working in a demanding environment like aged care? Tip: discuss your self-care strategies and the importance of mental health. Sample answer. I prioritize my well-being by practicing self-care and setting boundaries. I make time for regular exercise, which helps me manage stress and stay physically fit. I also engage in hobbies outside of work, such as reading and spending time with friends and family. Additionally, I believe in the importance of seeking support from colleagues and participating in team debriefings to share experiences and cope with the emotional challenges of the job. How do you adapt your communication when interacting with residents who have hearing or cognitive impairments? Tip: emphasize your understanding of different communication techniques. Sample answer. When interacting with residents who have hearing or cognitive impairments, I adapt my communication style by speaking clearly and slowly, using simple language. I also make sure to maintain eye contact and use nonverbal cues, such as gestures and facial expressions, to enhance understanding. For residents with hearing impairments, I may use written notes or visual aids to convey important information. Additionally, I ensure that I am in a quiet environment to minimize distractions, allowing them to focus on our conversation. Patience is key, and I always encourage them to take their time in responding. What do you know about the role of certified nursing assistants and how they support elderly care in the U.S.? Tip: focus on the key responsibilities of CNAs and highlight specific stress management techniques that ensure quality care. Short answer: certified nursing assistants provide essential support in elderly care by assisting with daily activities, monitoring health, and offering emotional support. To manage stress, I prioritize tasks, practice self-care, and collaborate with my team to ensure that quality care is maintained even during busy times. What are your salary expectations for this role? Tip: research industry standards and be open to discussion. Sample answer. Based on my research and understanding of the industry standards for this role, I would expect a salary in the range of. However, I am open to discussing this further based on the overall compensation package and opportunities for growth within the organization. My primary focus is on finding a position where I can contribute meaningfully and grow professionally. Do you have any questions for us? Tip: prepare thoughtful questions that show your interest in the role and the organization. Sample answer. Yes, I do have a few questions. Can you tell me more about the team I would be working with and the training opportunities available for new staff? Additionally, how does your organization support the well-being of its employees, especially in such a demanding field? I'm also curious about the typical resident-to-staff ratio in your facility.